So I want to bring in Dr. Stanley Fineman from Atlanta Allergy and Asthma. We've got to talk about fall. A lot of times people will see things peak once again. What are some of the issues when it comes to the fall allergies? Things like pollens. I've always heard, Dr. Fineman, that leaves on the ground too are covering up some old pollens. Is that true?
Well, it's not just the pollen, but it's also the mold. And I think the leaves on the ground are contributing to the mold counts that we always see rise in the fall and even through the winter in just about all the climates, quite frankly. So this time of the year, most places in the U.S., especially with the cold weather and the frost, we're not having the pollen that we had in the earlier part of the fall, but we're seeing a lot of mold. And of course, people are triggered by indoor allergens. Indoor allergens can include dust mites, which are little microscopic insects. They don't bite, but they are usually live in mattresses and box springs and feed on human dander. Dust mites are a real problem in the winter. Animals, of course, people can have allergies to their animals, and cockroaches is another allergen that's very common in indoor allergen.
Dr. Fineman, obviously a lot of us are going to clean up our leaves, right? We're going to do some yard work. Is there, light leaf blowers, they're very common, right? A lot of people use them. Is there a danger of using maybe a leaf blower as compared to raking? Does that create a greater trigger for you if you're lofting all that stuff into the air?
Well, I haven't seen any studies per se, but the patients that I see report that they usually have more symptoms when they use the leaf blowers. And in fact, they find that if they use a mask while they're doing their leaf blowing, they seem to have a better able to control their symptoms.
I have dogs, Dr. Fineman, and they seem to have issues too. The days they go around with the itchy paws. Let's talk a little bit more about things that come with the season that we usually like: scented candles, other holiday decorations. We can get some allergy issues because of those, right?
Absolutely. The scented candles and the fragrant oils, and even a Christmas tree that has a scent can trigger it. These are called volatile organic compounds, or VOCs. And patients who have allergies or inflammation in their airway can be triggered by these irritants. They're really irritants. They're not really allergens, but symptoms can be very much the same, including nasal congestion, irritation, sneezing, coughing. So you can get a very similar symptom, even just from something simple like a live Christmas tree that has a scent, or one of the fragrant candles.
Dr. Fineman, how do we know if we have an allergic reaction to something? Or right now, flu is very prevalent, COVID is still an issue, RSV is very prevalent in small children right now. How can we tell the difference?
Well, sometimes it's not so easy because a lot of the symptoms are very similar. But with an infection, typically we'll see a fever, particularly with the COVID or with the flu symptoms. We'll see fevers. We see more cough. We see more malaise or feeling run down. Allergies tend to have association with itching. So you have a histamine release, so you can have nasal congestion and sneezing, but typically you get itching. So you get itching in your nose, itching in your eyes, and you don't get a fever. So if you have a fever, typically it's because of an infection, not an allergen.
What should we be doing? It's a hard sell getting somebody to not go with the scented candles. Is it stay on the over-the-counter medicine right now?
Well, it's interesting. Just nasal saline, just a little saline, like an ocean spray or air. There's a whole lot of different ones. Just a little ocean spray or saline in your nose can really help cleanse your nose, and you can use it throughout the day. If you're exposed to a fragrant candle, or you go over to somebody's house that's using these kind of scented products, carry a little saline or saltwater spray that you can use in your nose. It is medicinal, even though it's just saltwater.
If we feel like our allergic reaction might be a little bit more intense, would you recommend something like nasal rinses, or is that point a good time for us to go on to some sort of antihistamine? How long should we be on that medication?
Well, I mean, the ideal thing is to find out exactly what's causing your symptoms. And of course, allergy skin testing can help determine if it is an allergen. I mean, if it is a dog dander or a dust mite allergen or a mold that's triggering these, then there's a different types of treatment that you could use, like allergen immunotherapy or allergy desensitization, that can really help you build up a tolerance. Symptomatic medications like that are over the counter, such as an antihistamine or a nasal steroid, they do help with some patients with allergies. But again, don't forget the simple saline. I mean, that's very, very therapeutic.
Well, Dr. Stanley Fineman from Atlanta Allergy and Asthma, we thank you so much for your time. And you always teach me something new. Like, I didn't know cockroaches could be worse, that you can be allergic to them.
Mm-hmm.
Oh,
Yeah,
now my wife,
unfortunately, you can be, and it is an allergen, can cause symptoms.
Great, now you've given my wife just one more reason to make me kill them. And then not her.